Good afternoon, everyone. I want to thank all of you for joining us this afternoon for our community conversation. Let's talk about health as we speak about diabetes. I'm Donna Jacobs, Senior Vice President at the University of Maryland Medical System, and I will be your moderator today. Our monthly Let's Talk About Health community conversation series is designed to do four things: increase awareness about community health issues, provide critical information to our community in a clear, concise, and useful manner, improve patient and healthcare provider interactions, how we communicate with one another, and help patients and families gain tools that can assist in maintaining and/or improving overall health. Diabetes is certainly critical to our community and is an important health condition that we speak about. It merits our intention and our attention because it has so much impact on so many, and thus this conversation today. Diabetes refers to a group of diseases that affect how your body uses blood sugar or glucose, and some people just call that sugar. Glucose is important to your health. It provides a source of energy for muscles, tissues, and also the brain. There are different types of diabetes that will be discussed today, but fundamentally, the issue is excess sugar in the blood, and it can lead to significant health issues. We have with us one of our most preeminent educators. She's a leading diabetes health educator to lead this conversation today, and that is Angela Ginn-Meadow, who you see pictured there on your screen. She's the Senior Education Coordinator at the University of Maryland Medical Center Diabetes and Endocrinology Department at the Midtown campus in Baltimore. She holds a Bachelor of Science in Food and Nutrition, and she just completed her nursing program and passed the boards in July of 2019, and I meant to say congratulations to you, Angela, about that. She's very dedicated to healthy eating, healthy living, and healthy weight maintenance. In addition to her day job, she's also the owner of a consulting practice, Real Talk, Real Food. And she regularly develops nutrition education programs for disease prevention. Ms. Ginn-Meadow is a past national spokeswoman for the Academy of Nutrition and Dietetics, and has been featured in Marie Claire, Food Network, Everyday Living, Prevention, and Better Homes and Gardens. I should say to you all that if you have questions along Ms. Ginn-Meadow's presentation, please feel free to type them in the Q&A box, and she would be happy to answer as many questions as time may allow. The other thing that I'd like to advise everyone is that the slides presented today will be available to you following this presentation, and I'll give you more information on that later as we go along. So thank you again for joining us. And Angela, would you like to get started?
Yes. Well, welcome everyone, and thank you, Donna, for allowing me to present today. The one thing that I want to make sure that we accomplish is a way to take charge and use Ask Me 3. So Ask Me 3 is a program that suggests using 3 simple, straightforward questions when talking to your doctor, nurse, or pharmacist, or a healthcare provider about your health. The first thing, what is the problem? Number 2, what do I need to do? And number 3, why is it important for me to do this? So we're going to make sure we give some examples to this for diabetes. So let's get started in talking about diabetes. So the first thing, let's tackle what types of diabetes there is. So there's type 1 and type 2 that are most common. And type 1 is the pancreas. Basically, it's no longer making insulin. Whereas type 2, your cells are not using the insulin well, and eventually, over time, your pancreas stops making insulin as well. And so type 1 diabetes, now this is a very small percentage of the population. It's about 10% of the population living with diabetes actually has type 1. It's common in youth, but it does not mean that if you're an adult, you can't develop type 1 diabetes. The treatment is insulin, and that's always the treatment. And the biggest thing is knowing the signs and symptoms. So when we think about signs and symptoms, especially with type 1 diabetes, it is sudden. So it's sudden weight loss, a loss of energy. It's also increased thirst, frequent urination, blurred vision, or hunger. And these happen all of a sudden. Whereas with type 2 diabetes, it is progressive. So let's talk a little bit about prediabetes. Now, this is when you need to make sure when you're checking in on problems. So there is a difference. So prediabetes is one step in the door, and when we are doing a fasting blood sugar, that fasting blood sugar is 100 to 125. If you have a blood sugar of 126 or higher, you can be diagnosed with diabetes, and that's type 2 diabetes typically. And then, or they can look at your A1C. So A1C is a measurement of your blood sugar over the past 2 to 3 months. And if your A1C is 6.5 or higher, it's also often diagnosed as type 2 diabetes. If you have prediabetes, it's 5.7 to 6.4. And normal without diabetes at all, your A1C is 5.7 or less. So type 2 diabetes is the most common. And I always say, guess what? I know plenty of people with type 2 diabetes, especially in my family. I'm at risk. And because my father had diabetes, I have a 40% chance of developing it. 90% of the cases of diabetes have type 2 diabetes. And it increases with age. It also, especially, it can be common in teens and young adults. We also find that any ethnic group, so if you are of color, you're at risk of type 2 diabetes. If you had a pregnancy that had a baby of 9 pounds or greater, you're at risk. And if you have gestational diabetes, you are at risk of type 2 diabetes. So knowing your risk is really important. So the signs and symptoms of type 2 diabetes are similar to signs and symptoms of type 1. But the difference between type 2, it's gradual. So type 1 diabetes is all of a sudden, whereas type 2 is gradual. And you may not even have any signs and symptoms at all. I will tell you, sometimes it's very subtle with type 2 diabetes. It could be a cut or a wound that doesn't heal very well. It could be if you're a lady and develop a yeast infection, that could be a sign of type 2 diabetes. So getting checked is really important. So what is the treatment? So we know that type 1 diabetes treatment is insulin. That's the only treatment. But type 2 diabetes, it actually has many treatment options. Some people just do lifestyle, that's diet and exercise. And some people actually all take medication, like oral medication, like pills or injectables or insulin. But the key is really knowledge. Knowledge is your power tool for managing diabetes. So learning about healthy eating, exercising, monitoring, and physical activity. So let's use our questions now. So the question reads, I have put on a few pounds over the past couple years, leaving me with less energy, and I always feel like I'm thirsty. So to answer this question, these are some signs that could be an issue of your blood sugar. It could be you gaining weight over time, less energy, that's fatigue, which is a sign and symptom, and thirst is a sign and symptom. It is important not to ignore these signs. So what do I need to do? I should schedule an appointment with my doctor to really discuss my lab work and get tested for diabetes. And why is this important to me? You want to reduce your risk of diabetes, especially if you have prediabetes. It's just one step in the door. You can prevent diabetes once you know your results. And also, Prediabetes can also lead to heart disease. So knowing your results is really important to preventing complications. So we got to talk about food because healthy food choices are the key to diabetes care. It's really the foundation. So no matter what medication you're taking, healthy eating and physical activity are your foundation and pillars to better health. Monitoring and knowing what your blood sugar is, and also education and support. And that's what we really offer here at the Diabetes Center. So what are you eating on your plate? I always think about portion control. So portion control, half of your plate should be your veggies. A quarter of your plate should be your protein, and that's lean protein. And then whatever starch you choose, it should be another quarter of your plate. Make sure your plate is no bigger than 9 inches. And eating this way, there is no special diet for diabetes, but eating this way is really healthy and for you to have a wide variety of nutrients. So let's go on for building your blocks of good nutrition. Carbohydrates, protein, and fat. You can have carbohydrates if you're living with diabetes or preventing diabetes. It's about choosing the right kind. So what type? So I think about carbohydrates are a big umbrella, and they include vegetables, they include grains and cereals, milk and dairy, and fruit. Each one of these give you vitamins and minerals, so you don't want to cut them out of your diet completely. Now, sweets and sugars have carbs too, and these are the things we want to limit and cut back. Those are things like added sugar that we can add to our coffee. Those are things like drinks that have additional added sugar like juices and sodas, and then those chips and cookies and cakes. So we try to make sure that we really cut back on those things, especially if we're preventing or managing our diabetes. So what's a serving of carbohydrates? And I want to go over this really briefly, but this will help you if you're living with diabetes or helping someone to better understand it. 15 grams is the magic number for one serving of carbohydrates. It may be a piece of fruit that fits in the palm of your hand. It may be a half a cup of corn, a slice of bread, a half an English muffin. It could be a cup of milk or a half a cup of lentils. So let's add it all together. So people often ask me, how much carbs should I really have a day? Do I have to go low carb when I'm having diabetes? Do I live with diabetes or preventing diabetes? No, you shouldn't. So on average, women should consume, if they want to lose weight, anywhere from 30 to 45 grams of carbohydrate per meal. Men, 45 to 60 grams per meal. If you want to maintain your weight, we want to consume anywhere from 45 to 60 grams of carbs if you are a woman, and that is per meal. And for men, it's 60 to 75 grams per meal. And people that are very active, you would never go without carbs. You should consume, women, 60 to 75 grams of carbs, and for men, it's 60 to 90 grams. So you do not want to cut carbohydrates out of your diet. So let's do a little sample of breakfast. All right. We don't worry about the herbal tea because we're not adding any sugar to it. We are going to have a half a cup of milk. We know that is about 7 grams. We are going to have a half a cup of strawberries, and that's about another 7 grams. And then my dry cereal, a cup and a half is about 2 carb choices. So my 3 carb choices equal 45 grams. That looks like a full meal. And that would be an amount that a woman would have for a meal if they were trying to maintain or lose weight. Now, this is lunch. You know, I always think about people say, well, can I eat all types of options? You can. You can still have rice. You can still have beans. And we know that salsa is free. Veggies are also free. But this meal alone, and you're using the plate method, would be 45 grams as well. So you can have a wide variety of food. And we're going to look at dinner. So when we count dinner, your salad is free. Your Italian dressing is free too, free of carbs. Now, if you choose to have sugar-free pudding, that would be 1 carbohydrate. Everything that's sugar-free is not carbohydrate-free. So we will get a chance to look at some labels. With your meatballs, that's protein, that has no carbohydrates in them. What your spaghetti sauce does, which is one carbohydrate choice, and that's 15 grams. And your 2/3 cup of spaghetti would be 30 grams. So roughly around, that would be 60 grams of carbohydrate. That would be a meal for a man, for a meal. I always ask, what times do you eat? So eating regularly is really important, especially if you're living with diabetes and you're taking medication. So try to make sure that you have meals about the same time, along with the same portion size. This will also help your body really regulate how much insulin it's distributing, but also for your medication to work more regularly. You're not on that roller coaster ride. And we want to make sure we avoid skipping meals. So here is our food label. So when you're looking at food labels, look for the nutrition facts. Look at the serving size. Your serving size is going to read for that label. This label of choice says a half a cup. The next thing we're going to look for is our total carbohydrates. So a half a cup of this item is 13 grams of carbohydrates. What you want to make sure that you keep in mind is if I eat more than that, if I eat a cup of this item, now I know I'm at 26 grams. If I decide to eat the whole package, I need to make sure I multiply. But this item would be 13 grams towards your carbohydrate goal for your meal. Now, I know everything does not have labels, so we like to use Calorie King to really carbohydrate count for other foods. It's on the website. You can get the book. It will allow you to find things that are unusual. I think about different ethnic foods or even things you like to dine out. So my favorite section in Calorie King is actually the international foods. So I'm able to look up Chinese food or look up Thai or look up Mexican or even look up Greek foods. It's really great to use. Also fast food as well, because we do eat on the go. So this is a resource that you can use to utilize for counting carbohydrates. So portion control. Oh, that can be really daunting. Make sure you dust off those measuring cups or measuring spoons and make sure you use them. Use them in the beginning when you're trying to learn how to count carbohydrates because they will help you over time when you start to eyeball or guesstimate your carbs. Your hands are always with you. So I think about a cup is always my fist, or it can fit in the palm of my hand. My palm actually is the portion size for meat. If I have cheese, it is the portion size of my whole thumb. If I have a teaspoon, it's a portion size of my tip. A handful of snacks, that would be for nuts, or having anything like chips, that would fit my palm of my hand. And anything like fruit or vegetables are like a tennis ball size. It should fit in the palm of your hand. Now, when you're trying to figure all these things out and you go to your doctor or come to a diabetes educator, it is great for you to write down items. I like to say for you to write down your food log. This gives us a better idea of what your typical eating pattern is, but also we can give you helpful hints so you can actually add in certain things or swap out things that may not be as helpful. It also allows you to realize what foods you typically eat. Are they a healthy choice for me or not so healthy? And am I hungry? Do I get hungry sometimes? So this is a great thing to just keep a sample food record. Now, fiber. Fiber is really key in all of this. Not only it makes you satisfied, but it also can prevent that rise of your blood sugar. It also will make sure you help you lower your bad cholesterol. It also keeps your blood sugar in target. I like to say fiber is like life's broom. It gets rid of all the gunk out of your system. It also keeps you more regular. Ladies, make sure you consume anywhere from 25 grams of fiber a day, and men is about 38 grams a day. The majority of the population are only needing about 12 grams a day. So we got some work to do, and it reduces your risk of colon cancer as well. So let's choose things that are healthy for us. Yeah, that donut, Sure does taste good, but more often, maybe we should choose yogurt with some fruit and granola. Or, we do love cheeseburgers and they are an option. However, why not get a sandwich and have a veggie instead? And instead of ice cream, why not having a fruit pop? Now, people may say, well, why do I have to worry about the fat if I'm only supposed to be worried about the carbs? And the reason really why is because the number one killer of people with diabetes is heart disease. So we want to make sure we choose things that are healthier and lower in fat. Shake the thought habit. We also want to make sure that you lower your blood pressure. So we want to make sure we avoid things that are processed. And if we do consume those things, we want to make sure that we eat less of them and think about your spices that you use. Now, alcohol. I know people may like a drink occasionally. It's recommended only 1 drink a day for women and 2 drinks a day for men. Make sure you talk to your doctor before indulging in alcoholic beverages. But when you're living with diabetes, it may cause for you to have a low blood sugar. So we ask for you to consume alcohol with a meal to prevent hypoglycemia. And grocery shopping. Ooh, grocery shopping is not quite like it used to be. But make sure you write a list. Think about all the things that you may cook or meal prep on the weekend. Make sure that you're filling that list with all your fruits and vegetables, your whole grains, and also making sure you're low-fat dairy and healthy oils. Make sure you don't shop when you're hungry because you will find items really in your basket that you may not choose, and check your labels. Now, when we're shopping smart, we want to make sure we look for meat that is lean. We also must make sure that we can get things that are canned, and we want to make sure that they are unbreaded and they are lower in sodium. And we want to make sure things that have trimmed fat, so skinless cuts of meat are also very helpful. And these are lean proteins. Now, I love fruits and veggies, and you want to make sure that at least 60% of your cart is filled with fruits and veggies. You can choose fresh or frozen. Just make sure that it has no sauce. And if you do have can is actually still pretty good. You just want to make sure you rinse it in tap and cook with a little bit of tap water. It gets rid of about 40% of the sodium that's actually in the can. And if you choose canned fruit, make sure that it's its own juice or water. And grains. Grains are not out of the option when you're living with diabetes. Just choose grains that are whole. Look for it in the ingredients. Choose 100% whole wheat. Make sure the first ingredient list says whole. Cereal should have less than 6 to 8 grams of sugar. And you want to make sure you look for things that are high in fiber. So your old-fashioned oats will have more fiber than your pack of oatmeal. So look for at least, I always say 3 grams or more. The side says 4, which is great because the more, the better. And it will help you better control your blood sugar. Now, dairy. Everybody doesn't do dairy, but the recommendation is 3 servings a day. And you may say, well, why? And the reason why is actually lowers your blood pressure naturally because of potassium in the dairy products. Reach for things that are lower in fat, especially if you're trying to lose weight. You want to make sure you lower fat, yogurt, milk, and you can also use milk alternatives as well. Just make sure they're unsweetened. Now, dining out. During this time, we are finding that we are picking up and carrying out more often, but the portion sizes are very large. Why not share an entree? Why not take home an extra container, dividing it right in half, or asking for a children's size? I also like lunch portion sizes when you go to certain restaurants. But portion control is really key to maintaining your weight and also preventing that rise of your blood sugar. Have it your way. Make special requests. Ask for half of it wrapped up before they bring it. Make sure you ask, can you not have it with extra butter? Can I have something baked instead of fried? I always swap out the French fries for a side salad. Or how is that dish really prepared? And if you don't want bread or chips, you can say no thank you if it is tempting. So I know fast food can get a bad rap, but there are some options out there. Think about things that are broiled instead of fried, having fruit aside of fruit, getting water instead of soda. And they do offer salads. And I'm an egg white fan, and guess what? There are tons of egg white sandwiches now on the menu. So Egg White Delight from McDonald's is one of my favorites. But there are some fast food options that can fit right into your lifestyle. Now, snack attacks. So I think about when you choose a snack, make sure you pick something that is naturally found. So it could be your fruit, it could be vegetables, it could be nuts. But it's really having that combination that I really enjoy. It could be making sure you have some protein with that carbohydrate. So if you have cheese stick, having some crackers. If you have fruit, having some nuts. If you have your veggies, having hummus. And if you have like popcorn, having, it could be like ham roll-ups. It could just be something. And actually that perfect combination is yogurt. So those are some ways that you can surely have some healthy snacks. So here's another question. Using Ask Me 3. I've tried some different diets. I can lose a few pounds, but nothing significant. What do I need to do differently? So I will tell you, dieting is not the thing because you really deprive yourself and you actually are really causing some opposite effect of what you want to choose. You really have to incorporate a lifestyle choice. And so what you need to do is you can work with someone that is a nutritionist or registered dietitian. We oftentimes are underutilized. But also you can talk to your doctor or provider about how can I get a referral or can you help me figure out what best meal plan is best for me. And then why is this so important? Maintaining a healthy weight and activity is really the building blocks of health, but also preventing diabetes. So exercise. We have to get active. Exercise is actually a medication for preventing and managing diabetes, one of the medications that is completely free. It keeps your blood sugar in target, it reduces your risk of heart disease, and also helps you maintain weight. The more exercise that you're able to get involved in and maintain it over time, it will be really important to lower your risk of diabetes. Before you get started, check with your doctor and make sure that you add activity gradually. And I say get active throughout the day. I use my phone app to see how active I am, taking the stairs instead of the elevator. Get a dog. I've done that for some of my patients. I've told them maybe you should get a dog so you can walk. Make sure you get active around outside the house. So raking leaves would be great during this time. Play with the kids if you're home with them. And take breaks. Do a 20-minute walk every day. So I want to make sure that I have time for questions, but you want to make sure you think about your plate. Make sure you have 3 meals a day and follow the plate method. So half your plate, your vegetables, a quarter of your starch, and a quarter is your carbohydrates. You want to make sure you choose healthier carbohydrates. Leave the sugars alone, but make sure you include fruits and vegetables, low-fat dairy, beans, and whole grains. And then we want to eat consistently. Try to eat on time and avoid skipping meals. Think about your hands as your portion size. And when you go grocery shopping, make sure you really go that U shape. That is outside of those aisles. So hit up the produce section, go to the meat and fish section, hit up dairy section, and then your grains. And then when you're dining out, make sure that you ask for half or smaller portions. And 150 minutes of physical activity is key. That is 20 minutes every day or 30 minutes 5 days a week for preventing and managing diabetes. So diabetes is a journey. It is not a race. It can be controlled. You can thrive and live with diabetes. You are not alone. The numbers continue to rise. So they already know that 1 in 3 individuals have prediabetes. And we know that 1 out of 10 individuals have type 2. But by 2022, we will continue to have more individuals with type 2 diabetes. And type 2 diabetes can be prevented. If you're one step in the door, do something about it. Know your numbers and prevent it. And get a team. So I always say the best team will help you along your journey because it will not be the same for everyone, but your team has really helped you to adapt a healthy lifestyle. And these are just some resources that you can you can use. So Diatribe is a great resource if you're living with diabetes. Diabetes.org is from the American Diabetes Association, and that is a great resource to find more information. For diabetes educators, and if you are a nurse or educating others on diabetes, that's a great resource. JDRF is a great resource for type 1 diabetes, and eatright.org is all about the food. That's the Academy of Nutrition and Dietetics. That will also be a great resource for you. So
Angela,
it is time for questions.
Yeah, thank you so much. That was action-packed and so much information. Your reputation precedes you, and there's certainly good reason. And I see all the things that I'm doing wrong, so thank you for that. We've got some questions here. And one is, oh my goodness, that was a lot of information. It's a lot of detail to follow. I hate counting carbs. I hate counting grams and calories. This is really hard. I get frustrated easily. How can I make it simple?
So the simplest thing is doing the plate method. Everybody does not have to count carbs. I always say build on your building blocks. So the first thing is just recognizing healthy carbohydrates, incorporating more of those into your lifestyle. Then you think about your plate. When you sit down, just make sure for at least 2 meals you have a half a plate of your veggies. Quarter is your protein. So protein can be chicken, fish, beef, pork, tofu. And then the other quarter would be your starch. And that could be anything from rice, beans, it could be corn, it could be peas, it could be macaroni and cheese. You know, Thanksgiving is coming right around the corner. But following the plate method is an easy way for you to help you manage your diabetes without having to worry about counting carbs.
That is really great. That's really great. So what about intermittent fasting? You mentioned 3 meals a day, but people are being encouraged to do intermittent fasting. What do you say about that?
So I want to first say, if you are doing intermittent fasting, you need to be partnering with your provider. Because if you are taking certain medications, you are at risk of having a low blood sugar. But intermittent fasting has been shown to lower the risk of diabetes in some individuals. Intermittent fasting could be a crunch of time that you are not eating meals. It could be fasting for a good amount of time, that would be 16 hours or more. But working with a healthcare professional is really important. It's not for everyone. It can be helpful in regarding weight management for people to actually maintain their weight, but we actually focus this on an individual basis depending on how many days you're actually fasting.
That's great. Here's a question that says, you mentioned sodium. Are there other spices that might be an issue for diabetes?
So, sodium is the most common one in regarding managing your blood pressure. But I would say there are a lot of herbs and spices that aren't problematic, they're actually helpful. So one is cinnamon. You may have heard about cinnamon. And that research really has shown about prediabetes and using cinnamon as a tool to help you with post-meal numbers, so that postprandial spike. But there are also things that are really great antioxidants, like your oregano and your thyme and turmeric. All of those spices actually have really great properties to boost your immune system. And they really are a great replacement to when you're lowering the sodium. Lemon as well, that's a great agent to give flavor enhancement when you're lowering the sodium intake.
Those are great suggestions. They all help vary the taste of your food and keep it more interesting as well. All right, I have someone who's written in that my son has type 1 diabetes. What is the most prevalent or most important information that you might give me for him?
So we know type 1 diabetes is treated with insulin, but think about all the building blocks your son still needs to use. So still healthy eating, so that is still very important. Also, physical activity also is important, and understanding his medication regimen is very important. The most important thing, the takeaways with all my clients that are managing type 1 diabetes is understanding what are the signs and symptoms of highs and lows. So those high blood sugar symptoms are thirst, frequent urination, blurred vision, hunger. And if they especially see that they're having abdominal pain or vomiting, that means they're in trouble. Testing your blood sugar is so important. I think sometimes we don't talk about that as often, but monitoring and understanding what's going on with your body is very important. And having a team, when you have type 1, you really need a team surrounded. That may be an endocrinologist, it could be a primary care doctor, but also a diabetes educator to help manage your lifestyle with type 1 diabetes.
Okay, a couple more questions here. I've heard that certain markings on the back of the neck can be a sign of diabetes. Is that true, and what are those markings?
That is so true. I recently did a video about that. It's called negricands, and so in the back of your neck is that dark, shiny color in the back of the neck that you may see on people. It is not dirt. That's the one thing I say. It is a sign of insulin resistance. That insulin resistance, it just tells us that you may be at risk of type 2 diabetes. It also is a sign that we have to lose the weight around our waist, because that is one of the indicators of insulin resistance. And we also have to get active. So 150 minutes of exercise. But if you see that sign, that dark leathery in the back of the neck, get tested. See if you have prediabetes or type 2 diabetes and do something about it, because you can prevent type 2 diabetes.
And is there also something, this is my question, like a cross pattern at the back of the neck where you see that dark marking as well as sort of a fat deposit at the base?
It's not necessarily a fat deposit. It really is just that all the way across the back of the neck where it is leathery and dark. It can be shiny too, and most times people don't quite know what it is, and we see it actually in children very often. And, you know, you may say, oh, what is that? Did you wash? But it really is, it's a sign of insulin resistance, and it is something that we need to make sure we get tested and also do something about.
Thank you for that. Here's a question about foods and substitutes. So what's your opinion on this term, not real ingredients, substitutes that are aimed, or so they say, to help you lower your weight and lower your blood sugar, such as margarine instead of butter or other things?
Okay, so I will tell you, I'm a fan of real food, all right, but what I would like to say is there is a time and a place for every substitute. So tub margarine was an important substitute to butter because tub margarine has less saturated fat, and saturated fat can increase your risk of heart disease. Now, if you said, I don't want to use that stuff, what you would do is say, well, maybe won't I use olive oil? Because olive oil is a natural oil that has monounsaturated fats, and it has no saturated fat in it. So really picking and choosing what substitutes are important to you, but understand the substitutes oftentimes are needed because we want to prevent of further complications of diabetes, and heart disease is one of those complications we want to prevent. And we know that's the #1 killer of especially women and also people living with diabetes. So those substitutes can be important. One substitute, Donna, I know we're running out of time, but one substitute is important is getting rid of the regular beverages. So regular beverages being sweet tea, sweet lemonade, soda, chocolate milk, those things need to be substituted if you are living with diabetes or preventing diabetes. they need to be substituted with water more frequently. It could be substituted with something that is unsweetened, like an unsweetened iced tea, or you could use, if you choose, an artificial sweetener. So these are options. They have options for a reason, because we like choices, but we want to make sure we maintain our health as well.
Someone wrote in that, I'm a picky eater and I don't like foods that taste badly, but I think you've given some suggestions there. So I'm going to give you a two-part. I'm going to combine two questions together. And one is type 2 diabetes reversible? And then the subpart to that I'm just going to throw in here is, are there any diabetes-friendly meal prep services that you're aware of, especially for people on Medicare?
Okay, so reversible. It can go in remission. So studies have shown individuals that actually have weight loss surgery, bypass surgery, gastric bypass surgery, or having sleeve surgery can put their diabetes in remission. Individuals that lose a large amount of weight also can put their diabetes in remission. However, if you go back to your old habits or regain the weight, the diabetes is always going to be there. So I want to make sure that we have a clear understanding that even though it may go in remission, and that means your A1C may be less than 5.7, but if you go back to your old habits of eating, anything, and not exercising or not taking certain medications when you are recommended, it will creep right back up. And as for meal prepping, you know what? That is a challenge. I would say that Meals on Wheels and also movable feasts, if you, especially being a senior, if you actually mark on there that you have diabetes, they actually provide low carbohydrate or healthier meals regarding your diabetes. But I do believe with this, this new world we're in, I do believe more and more meal prep services will focus on health-related meal prep and not just weight management.
All right, we have just a couple of minutes, but I probably have another half dozen questions or so. I'm going to ask one, and then I'll remind the viewers that these slides will be available to you at a subsequent time. And I'll also ask Angela if she wouldn't mind answering the questions that we don't get to, so I'll tell you where to find those online. Would that be okay, Angela?
That is perfectly fine.
Someone did say, what should the blood sugar be after you eat a meal?
Okay, so quick rundown. Before you eat, your blood sugar is recommended to be between 80 and 130. That's according to the American Diabetes Association. So that's before you eat. 2 hours after you eat, it should be less than 180. Now, what I'm going to tell you is, typically for my clients, we usually say, check your blood sugar before and then 2 hours after. See what the rise is, because it should not rise more than 60 to 80 points. That tells you if your meal was too large or if you had too many carbohydrates or the quality of the meal was not the best. So I do encourage you to check your blood sugar before and 2 hours after and see what the difference is. But it should be less than 180.
This has been an amazing amount of information, and there are several comments in the chat line or the Q&A line to that effect. So again, we will make this information available. Let me go on and give you all some other information. If you would like to see this event again, or you would like to see these slides, you can go to our website, which is www.ums.org/letstalk. And this presentation will be available in about 48 hours. As well, you can go there and see the prior presentations in this series, which are one on technology and telehealth, which has become very prominent and very well utilized very effectively during this COVID pandemic. Accessing care, which is much more about the examples that Angela gave, where you have a question, you want to communicate with your provider, you want to understand what your situation is and learn to what to do about it. That will give you information about how to make your engagement and your conversations with your providers much more robust. There's one on children's health and safety. There's also one on men's health and women's health. All of those we've done in the last several months, and they are available to you. Coming up, next month in December, we're always doing these on the third Wednesday of the month at noon. We're going to be talking about lung disease next month. And with that, just once again, Angela, let me say thank you. Please all go to the website if you would like to get additional information about this program or any others, and we'll try to get all of the questions that were posed today, get answers to those for you as soon as we can. Again, thank you all for joining us, and Angela, thank you so much for that vast amount of information.
Thank you.
Bye.